But let me thank you, Madam Chair, and the Ranking Member Cole for your leadership, and of course, Chairman Lowy, who I got to salute in my last subcommittee meeting. I just thank you again for your years of fabulous leadership. Before I get into, I just have a few things I want to say about this bill, but I do want to remind everybody that Dr. Fauci just said recently that it's a false narrative to take comfort in a lower rate of death. So while I appreciate all that we do in this committee, and we do a lot to fund our healthcare system, I think I would like to join our chair lady's comments, wishing that our president would show better leadership. With that said, I want to talk about this bill. It's a robust bill that propels our investment in our children, our families, our veterans, and older Americans, including funding for childcare, medical advancement, and gun violence research. I want to highlight three other issues. First, millions of Americans are currently out of work with the highest unemployment rate since the Great Depression, families unable to pay their bills, buy their food or prescription drugs. And unfortunately, many state unemployment systems are antiquated and unable to respond to the need. My home state of Florida, listen to this, hundreds of thousands of unemployed workers have yet to receive a check, and many hundreds of thousands more have only been partially paid their desperately needed benefits. So thank you for this bill that provides an additional $84 million in the base to support state unemployment insurance systems, and another $925 million for states to handle unanticipated unemployment workloads during the pandemic. Second, COVID-19 pandemic has had a devastating impact on the health of our seniors. This is especially true here in South Florida. Older Americans are particularly vulnerable during this public health crisis and have faced higher hospitalization, mortality rates, and they are encouraged to isolate themselves to keep themselves safe. And extreme social isolation can make loneliness, stress, and mental health challenges such as depression and anxiety even worse. And this pandemic has made it more difficult for many seniors to obtain basics such as food and to fill prescriptions and to be physically active. And it's also made it harder to receive the full care from caregivers. So I'm glad to see that this bill provides funding to the Centers for Disease Control to expand its healthy aging work, to promote the health of older adults and coordinate services. And third, I want to just highlight some remarks, Madam Chair and Representative Lee, concerning women and access to reproductive care. Women, not politicians, must be in charge of their own reproductive destinies. So in this bill, thankfully, Title X family program continues to be funded, and the administration is required to carry out the Title X family planning as it was intended, stopping Trump's senseless domestic air glue on its track, which has been defunding Planned Parenthood all over this country. Madam Chair, I look forward to the day we can ensure that all women have access to full reproductive care, regardless of their zip code or their income. And with all that said, I am proud to support this excellent bill as we move it to the full committee, and I yield back.